Okay. So I think we can start. Good morning. Welcome to this session dedicated to lifestyle medicine. And we have Dr. and Professor Mladen Golubic of University of Cincinnati today with us. Mladen was a keynote speaker at our last symposium in Pittsburgh last year. It was a huge success. And then, of course, we invited him to come specifically for this patient and family session. As we know, this is a unique aspect of Camden GVHD Symposia, that we have this patients and families sessions and everybody together, what creates this unique atmosphere where we keep coming back and back for 15 and plus years. So just say a couple things about Dr. Golubic to make sure he's the Osher Center Distinguished Professor and Medical Director for Integrative Health and Family and Community Medicine at the University of Cincinnati, where he has been since January of 2021. Prior to this, Dr. Golubic dedicated 3 decades at the Cleveland Clinic for fulfilling dual roles as a scientist and the dedicated physician in patient care. Dr. Golubic started his training and whole work for all these years at the Cleveland Clinic with some of the pioneers that really laid the foundations of what we call lifestyle medicine today. We hear more about all the pillars and things that you're going to recognize that in daily practices and patients and clinicians, we have similar questions, and I think we heard some very good answers. We look forward to some time for questions after the presentation, so please think about how we can interact. To be added is that Dr. Golubic is a graduate from Zagreb School of Medicine in Croatia, and where he did his PhD. He did his PhD for 5 years at the Max Planck Institute in Germany. And just needless to say that he presents all over the grand rounds at the conferences and public events on the topic of lifestyle medicine, and we just look forward. Thank you, Mladen, for driving from Cincinnati and being here with us today. Welcome.
Thank you. Yeah, thank you very much, Dr. Pavletić. Thank you very much for having me here. I have a lot of slides, and I'm hoping that we'll be able to create like PDF and send with everybody who was there. So that's why I included, but I'll go very fast. Since we are running short on time, I'll skip some of the short videos. And I think the nicest part of these presentations is answering questions, because you might have different interests. So let me move to the side so that I don't obstruct the view for anybody. So this is the definition of lifestyle medicine. Essentially, paying attention to the things that we can do for ourselves, self-care, yeah? All the things that are important, food and movement and sleep and relationships and so on. The difference is that in many other specialties, this is not the primary therapeutic modality. In lifestyle medicine, that's the primary. This is a complex slide. I want to make a couple of points here. These are 6 pillars of self-care, of lifestyle. 7th one, unofficial, being the nature. And they all interact. If you want to impact inflammation, inflammation is a big thing in any disease, and especially in blood cancer field. You can do this through changes in your eating habits. You can do this through the meditation, stress reduction practice. You can do it through the physical activity. You can do it through sleep. So the point here is that you might not be super excited about changing your eating, but you want to focus on improving your sleep or your physical activity. You know that you will impact those key pathophysiological mechanisms in synchrony with other Yeah. And all of these things are very important for just maintaining the health and even if sometimes reversing the disease. So these are all the conditions for which lifestyle medicine is of use. Of course, we'll focus on cancer and specifically on blood cancer. Again, it's universally recognized that we really need to focus on enabling quality of life and good orientation towards healthy living for any cancer survivor. And this kind of now extends from the oncologists to primary care and collaboration with experts in nutrition, exercise science, behavior change. And I added here culinary medicine because often it's very important not just to know which kind of foods to eat, but how to prepare them so that they taste good. So this is a review that Dr. Pavletic, his group, we put together. So I will not go into big details. The point one is that there is people with blood cancer who really have the same issues with chronic diseases like anybody else. And in addition, they are at high risk because of the treatments that they receive. Yeah? This kind of summarizes how prevalent is the risk of cardiovascular and metabolic disorders for patients with after the stem cell transplantation. And what is very interesting is this collaboration between pharmacological interventions and lifestyle. They are not mutually exclusive. The best is when you combine them both. All those risk factors for cardiometabolic diseases, yeah, heart attack, stroke, can be mitigated by lifestyle changes. So we know how we can even arrest the progression of diabetes. We just talked earlier about Dr. Kim Williams, past president of the American College of Cardiology, who said, can we put cardiologists out of business in 10 years? Yeah, that's how powerful lifestyle is. And that's based on the work of dear colleague and mentor, Dr. Esselstyn, and then Dr. Dean Ornish. They have shown that you can, through lifestyle changes, even reverse advanced coronary artery disease. And last year, Dr. Ornish published a randomized study where they looked at patients with early dementia, early Alzheimer's, and showing that when you compare the control group for 20 weeks, their scores on cognitive performance worsen. Higher means it's worse, and intervention group improved. Yeah, so this is the first time that you can take a chronic condition such as early dementia, and through lifestyle changes, you can reverse it. So tremendous potential. Now, why this is important for anybody with blood cancer in general, because there is a common cognitive dysfunction, fatigue, disturbed mood, and sleep. So through all of these mechanisms, a lifestyle intervention can help. Now, this is really the main point of my presentation, and that is people know that it's a good idea to move and to eat well. It's just that I don't like to do that. Yeah, this doesn't taste good. Yeah, I'm too tired to do 5 minutes of meditation. Yeah. And this is very, very common. So I'll quickly go through some of those things. I will look here that I don't overdo, and I'll skip some of the slides. I want to mention 3 principles. So no matter what, yeah, if you want to change anything in your self-care, you have to start experimenting. You have to choose where you will do things differently. And it can be 5 minutes, 3 times a week of something new. Yeah. Evolution, meaning progress, not perfection. You do not jump from here to there overnight because usually it's not sustainable. It can happen, but the most effective is that you learn maybe 1 new dish in a month. In 6 months, half of your diet is different. Yeah. And so on. So let's look here at physical activity. I think, needless to say, so there are studies, and I'll skip those, that when you engage in physical activity, here they looked at 11 of those studies, you improve Yeah, no matter in which phase of your disease you are. And then this is one for patients with multiple myeloma. Yeah, how important is this was randomized study, small study, 34 patients, and almost anything that they measured was better. Yeah. You can see here all those symptoms that improved, and their treatment was more successful. They didn't need to change the doses. They had less side effects, and they felt less fatigue. Look at this, 6% versus 75% in fatigue, and this is very, very difficult to do. Yeah, so you know, and this was not super intensive activity. Yeah. I'll skip this study. This was with breast cancer, showing the same benefits. Now, American College of Sports Medicine says, almost anybody will benefit from moving more. Yeah. Now, there are always excuses. I'm too old, I cannot do this. Yeah. So we just immediately tell our patients, that's what we expect after 6 weeks. I want just to mention this. What do you think is the percentage of people who use escalator versus stairs? Or let's turn it around. People who would use stairs when they have opportunity to use escalator. It's 2%. If you are the conference of exercise physiologists, it will be 8%. Okay, so we are wired to sit, and if there is one book that I would highly recommend, then this will be this one, Exercise, by Professor Daniel Lieberman from Harvard, professor of anthropology. This is how we are designed. When we don't need to hunt or gather the food or chase the mates, we do not spend energy. We do nothing. Okay? So, and we have environment, we created environment where we do nothing. We are not forced to do anything. Yeah. So just to tell you that you don't need to feel guilty, oh my God, I don't like to exercise, but you have to consciously make steps to do that. And American Society of Clinical Oncology, Society for Integrative Oncology suggests that if you have anxiety, depression, whether during active treatment, post-treatment, those are the activities that you can do. Low intensity, gateway exercise is acupuncture, yoga, tai chi, yeah? And then there are other modalities that you can use. For you, if you are excited about trying some yoga, for example, through the Osher Collaborative, our yoga therapists and the one from University of California, San Francisco, created a set of short videos, 5 to 12 minutes, yoga for different issues that we might have, yeah, fatigue and sleep and pain and so on. And it's very easy. You can just take this QR code, or you can just Google, and it's on YouTube. And if you do not have, opportunity to go to your local yoga classes, you can do that. Yeah, you just choose and practice. So we'll move here. Ideally, you want to move in the nature, right? Whenever you can. Now we are sitting here, and maybe at the next meeting there could be some activity, and we'll have some sound bath and so on. So people who spend at least 120 minutes in nature, they enjoy better health, period. And this is per week, 120 minutes per week. That's not difficult to achieve. There are even studies that if you take a walk outside for 15 minutes versus 15 minutes indoors on a treadmill, and then somebody tests you, give you a test, how fast you answer the things on a computer, how many mistakes you do, you will do better if you do 15 minutes outside. It's quite impressive, yeah? This came yesterday in my email box. It says, it's here, Nature as Medicine goes live. We are doing this already for a month, but it was an official University of Cincinnati protocol. And I have a short video, which I will not play for obvious reasons because of the lack of the time. So I will just skip this. But for you, what is important, if you want to know how you can engage, you can scan those codes and you can learn more about Nature as Medicine. It's the 7th pillar of self-care. I'm sorry, I will go back, but this should be in your PDFs, and you can always look into that. Sleep is common. I don't need to tell you about it. If you a patient or caregiver, I mean caregiver meaning co-patient, yeah. So the same thing, you know, what I mentioned here. It's valid for both groups. So almost, you know, 40% reported issues with sleep, and that's not surprising. Yeah? So what can we do about sleep? The key is to be in circadian synchrony. Yeah, and here it's unbelievable. About 10% of all the genes that we have are regulated by these day and night cycles, yeah, circadian rhythm. And here are some, you know, evergreen suggestions, you know, what to do. Exposure to bright light early in the morning, it's quite valuable. Like, for example, if you walked outside today for maybe 10, 15 minutes when the sun was getting, it was just perfect right before, or just the daylight was coming. That's very important to set up our circadian clock. And ideally, you want to wake up hungry and then eat good breakfast, and we had some good stuff there. In the afternoon, you want to warm up your core body. So get out, start moving 2-3 minutes, some yoga stretches, couple of wall push-ups, eat light dinner, and avoid bright lights. Don't work on the computers, put the mode where you can tone down the blue light because it will disrupt your sleep. That's how I feel on many days. It's a new science of stress. Yeah, I'm sure we all feel that way. Yeah. So here is what we can do about it. Now, for you as patient, clearly there is a lot of anxiety. I need to have all those procedures. And when I was at Cleveland Clinic, Diane Dushek, who was a nurse at the GI department, she ran a randomized study with patients who were undergoing GI surgery, who were listening to guided imagery, stress reduction practice. They reported after surgery, less pain, less anxiety, less use of medications for pain, and they were discharged 2 days earlier. Then the CEO of the hospital, who was cardiothoracic surgeon, said, that's not true. I want to see this for my patients. So they repeated their randomized study, and the same thing happened. Okay? So it's very powerful, just stress reduction, yeah? So this is that guided imagery, yeah? And we can do that with the practice. Yeah, the more we practice, we can do that. Why it's important to focus on this? Because when you practice those techniques, we become more flexible in our beliefs, in the things that we take for granted, the patterns that we run. And we kind of are more malleable to start eating different foods, or to start maybe, you know, exercising more, or being more social. Greatest stress reducers: friends, purpose in life. Physical activities is a great stress reducer. And the last one is that you practice how to elicit that rest and digest and repair a relaxation response. That is opposite from stress, fight or flight response. We can do that. Yeah, this is part of who we are. Yeah. We know that breathing, if we breathe certain, if we are under stress, we breathe different ways. If we are kind of relaxed, our breathing is different. Pay attention to that, yeah? So our ancestors thousands of years back said, what would happen if I changed my breathing? Would I feel differently? Yes, absolutely. By changing the breathing patterns, you can enhance your energy, you can calm down, yeah? These are a couple of links here to very simple breathing practices. And on these yoga 5 to 12 minutes videos on YouTube that I mentioned earlier, there are also 2 of them with just focused on breathing techniques. So you can practice that. Yeah, maybe that will be something that will excite you. Here is a very good formula. Wherever you are, whether you're a dentist, whether you're undergoing procedure, whatever you do, you just remember that you are breathing, that you are here. It's the simplest, always available stress reduction tool. You don't need any apps. You don't need anything. You just need to pay attention and notice that you are breathing. Yeah? I'm finally learning how to relax. Unfortunately, relaxation makes me tense. Yeah. Anybody in that category? Yeah, we feel guilty. This is not natural for our society. Yeah. I have so many things to do. I cannot do nothing. Yeah. So those techniques will also help you with this. These are all the positive things that happen when you practice some of those techniques. This was mindfulness-based intervention for caregivers who are equally stressed, sometimes more than the patients themselves. And it really shows how you can improve your well-being just by simple techniques such as mindfulness practice. These are all the classes that we offer free for our patients. So yoga, Tai Chi, mindfulness meditation. Every Monday morning at 8:30, Dr. Walker teaches Mindful Mondays. Anybody, you can live in Australia, you can join, scan the QR code, and you can be there. And then there are, on our website, there are pre-recorded practices again. Somebody likes male voice, somebody likes female voice, somebody likes music, somebody doesn't like music. You can find any of those. The key is that you find the practice that resonates with you. I will also skip that one. And the last couple of things about foods. So we will go to the non-fiction side, okay? A lot of us go to the fiction side because people write books, they write, they do some simple, literature reviews, and they are the experts. So what should we eat? That's a big question. We have pretty good ideas what should we eat as a group. Yeah, I mentioned to you earlier, you can reverse diabetes through dietary changes and heart disease. But this is as a group. Not everybody reacts the same way. So there is a huge NIH study, National Institutes of Health sponsored study called All of Us, where we will have those answers. Right? And very, very detailed study that we will know what is the best food for you at this time and for me at this time and what will be down the road. Now, we are not there yet, okay, 24th century with the food replicator, we will eventually figure that out, how to do that, but we are way far away from it, yeah? The best what we can get is the experts who every 5 years do the dietary guidelines, and you can see that it's eating more vegetables, fruits, legumes, whole grains, some fish, vegetable oils, and then reducing red processed meat, sugar, sweetened beverages, and so on. Yeah? Again, another set of experts rank the best diets. Mediterranean diet is the best for the past 8 years. Doesn't mean that this is the healthiest diet, yeah, for particular purposes, but it's the easiest to follow, and it has the biggest impact. Yeah, dietary approach to stop hypertension, very similar. Flexitarian diet, you can be plant-based, you can add some animal foods. And then this one, that's American College of Lifestyle Medicine. So the more you move here, the more benefits you will have. And I will skip some of those studies, but I wanted to show you how powerful it is when you are fully on that side. And Dr. Shah is there, and she can tell you everything about fully plant-based eating. So if you have questions about this, grab her, and she will inspire you so that you eat fully plant-based, all right? Yeah, that's okay. Thank you for being here. Yeah. I will skip this. So the only side effect of eating all plants is this one. Some people worry when we eat a lot of fiber, we'll have a lot of flatulence, and that will contribute to global warming, okay? I don't think you need to stress about this, lose the sleep, because the major contributor to global warming are farting cows and burping cows, okay? Because they release a lot of methane. So don't worry. I mean, this is the, yes, if you start eating more fiber, you will have more gas. But if you are moving, you will not even notice that you have it, yeah? Now, here is the question for you and for everybody is, why do we still continue eating unhealthy diets? Who doesn't know that eating more vegetables and fruits is good for us? Is there anybody here who doesn't know that? Yeah. Only 10% of people in the state of Ohio take 2 servings of fruits and 3 servings of vegetables a day. all right? So 90% do not. Yeah? So we have a lot of room for improvement. So this is how complex that is, what determines which kind of foods we will eat. Yeah, many factors. It's different in different societies, how we were brought up, what are our taste preferences, and so on. So this was done at Purdue University. You can see here that these are the reasons. Some people pay attention to nutrition. They said nutrition is the most important. Yeah, those usually who said my diet is excellent, they pay attention to this, environmental impact. But those who said my nutrition is poor, for them, the most important here is this: is it affordable? Is it available? I don't care so much about, taste has to be perfect, but whether it's healthy, I don't care. Yeah. And here are all the obstacles. Yeah, why we don't do this? I would say, yes, price is clearly obvious. We have totally screwed up, farm bill where we reward raising, foods for animal feed rather than human. But this is where we come in. It's hard to know which foods are healthy. How in the world that can be difficult, yeah? But there is a lot of confusion about it. And also, I don't trust claims about the healthfulness of foods. I mean, if you see, never eat blueberries because of X, Y, and Z, and then the other one says, eat blueberries to prevent your cognitive decline, what do? Yeah, so you are confused about it. So the point I'm trying to make, this is a wonderful article by Kevin Hall, who Dr. Pavletic know, because he really resigned from NIH because they tried to twist his. He is like ultimate expert and guru on ultra-processed foods. And as you can see here, this was the article that they wrote. It says it's not you, it's the food, and I added environment. It is environment that we created, yeah. Yes, we do have some, decisions that we can make about choices that we make, but if we live in an environment, we will not do this. When I drive to my work, I pass this advertisement for the UC Health where I work, and it says science stroke is reversed. It's amazing what we can do now, yeah? Modern medicine, it's incredible what we do. But then we do almost nothing about the environment that creates more patients with stroke, more patients with heart attacks, more patients with cancer, yeah? This is the food environment that we created. So that's why everybody has a responsibility to contribute to this, yeah? So don't eat like this. If you remember one thing about foods, chew well, okay? I could give you another full hour about science for benefits of chewing well. Even if you eat green leafy vegetables, don't chew like this guy who is the world champion in collard greens. 2.5 pounds in 17.5 seconds, okay? So you can go on our website and get the mindful eating guide and practice. You don't have to be like a monk or nun in the monastery to kind of say, honey, sorry, I need to chew. But when you get a chance, slow down, okay? In fact, we would need to get 10 servings of fruits and vegetables. And here are some suggestions from the recent Harvard Health Letter, how you can do this. Yeah, so you will have all of this in your handouts. Stock your freezer. Frozen vegetables and fruits are as nutritious as fresh when it comes to anti-cancer compounds. And they're much cheaper and more convenient. Yeah, so always use those. I don't care what the doctor said, refined people don't eat unrefined foods. Yeah, again, we feel like, we are not sophisticated eaters if we eat, the 100% whole grain. Eat beans, feed your gut microbes, and avoid this. Minimize this. It's impossible to avoid it, yeah? These are the things that you and I cannot make in our kitchen. These are 2 wonderful books. I'll skip this. This is what we feed our children. They get 67% of calories from ultra-processed foods, that our ancestors would not know what to do with this. They would not recognize this as a food. Where did we go wrong? Our son a vegetarian. Yeah, people get upset that their kids are eating plants, but they totally neglect that they can eat all kinds of very unhealthy unhealthy ultra-processed foods. So resources for you. At our center, we have two amazing chefs, incredible chefs. Dr. Chef Stephanie Michalak and Pamela Sharp, who is nurse practitioner working with me. They are spectacular. So there is a number of recipes on our website. You can check this. If you're interested in eating like Mediterranean style diet, my former friends, Dr. Mike Rosen and Chef Jim Perko, have like 113 different videos about different recipes. Yeah. And then if you want to be fully plant-based and experiment with this is a wonderful cookbook of a wife and daughter of Dr. Esselstyn. And then there is also Taming Inflammation recipe book by the Cleveland Clinic and Arthritis Foundation that have 23 anti-inflammatory recipes. So there is no lack of recipes, yeah, and there is lack of desire to do that. And I hope that you will be inspired to do this. We have also QR code for this. I put this that I'm lucky that I'm not astrophysicist. They don't know anything about what they are studying. At least in our field, we know a little bit more. And I just want to finish with this. Medicine is just one aspect in society. Whether you work in any other aspect, we all have responsibility to enable us as a society to move forward, to create healthier environments, to eat better. This is a new center for blood cancer healing center, where we will have from March 1st on the 5th floor, we will have state-of-the-art teaching kitchen. We will have mind, body, spirit room where we will do group classes, and we are looking forward to that. But it has to start with you. So eat plants whenever you can. Keep moving. Make sure that you sleep well, that you are present, paying attention to what's going on, in spite of everything what's happening around us. Yeah, just keep calm and love people. And I think if we do those things, we will enjoy very good health. So I will stop here and I'll be happy to answer your questions. I'm sorry I was speeding up through this, but questions, okay? Let's go. Here is a mic for questions, but for our friends who are online. All right. There are questions, okay. Yes.
So one thing you didn't talk about was water, drinking water. And I feel like I'm a camel. I just, my whole bone marrow transplant experience was, you need to drink, you need to drink, you need to drink. I couldn't possibly drink, 5 of those a day.
Yeah.
So my question just about water and the importance of that. You didn't talk about that, I don't think.
I didn't talk about it because I don't know enough to be kind of expert about that. In general terms, the sense of thirst is quite basic instinct. Unless you are really in ICU and you don't have good access to water, you'll not have that urge. But for all practical purposes, you'll be okay. Yeah. Now it depends what else are you drinking. If you are drinking the other things like coffee and tea and of course soda, I hope not. That can kind of require more water. Which kind of foods you eat? Yeah. If you eat vegetables and fruits, you have plenty of water there. Yeah. So, but yes, I would just say follow the advice of your doctors, of dietitian. If they said, drink this amount of water, try to get. But clearly, there is a limit to what you can do. No other questions? Everything is clear cut? Yes, go ahead.
You see a lot from influencers, I guess I'll call them, about fasting to get into autophagy. Is that something that you talk about or that you're studying, or is it just we?
Very good question, and I'm glad that you asked this. And as you could imagine, there are so many topics to cover. Yeah. So when it comes to fasting, I'll be, very brief. People have looked into this very, very carefully, and there are many different ideas how you should do this. I would direct you to read the work of Dr. Walter Longo, because they did really the most reliable and very well-controlled studies, both in humans and in animals. And the summary is this, that when you go on a full fasting, that you don't take any food, yeah, you just take the liquids, they have shown that you decrease the diversity of your gut microbes. And it takes time to recover them. So what they devise a system where for 5 days in a month, you cut down on calories. You still feed your microbes, but just less calories. And then you repeat this over 6 months, and they have shown through a number of markers that look really very promising. And there are a couple of publications with the Italian group where they followed 200 patients with different types of cancer. There was none with the blood cancer, showing the benefits in the immunological response and also in their outcomes. So Walter Longo, of course, what it happens when you create something like that, then the institution where you work, they want to patent this. So there is like prolonged, they said people don't have time, to cook for 5 days, some vegetable soup and eat some handful of walnuts. So we will send you the meals. Yeah. So there is this commercial, thing there. But that would be my advice. But nothing happens if you fast for a day. I think it's, it depends where you are. Yeah. If you are in the recovery phase and you're able to exercise and you sleep well and so on, then you can experiment. I would not do this, put extra stress. If you are really just recovering, I think you need food, you need good food. And just chew well. Yeah. Yes.
Regarding keeping storage of frozen fruits and vegetables, should there be a concern about whether they're organic or not in terms of the pesticide concentration?
You ask all the amazing questions that I didn't have time to cover. Thank you for that. Yeah. So in ideal world, yes, it's better to use something that has less of the chemicals. However, again, another thing you can write down, Environmental Working Group, EWG.org. Every year they go to the grocery stores and they sample the produce, fruits and vegetables, and said, which ones have the highest level of pesticides? So they created a list, dirty dozen. Strawberries, some of those berries, usually they're apples. Yeah, they are heavily sprayed. I mean, if you grow apples in the state of Ohio, you will have to spray. If you don't do this, fungus will destroy your orchard. So if you can, then try to cut down on those. But then there is Clean 15, those that have minimal amounts. So why would you spend money on something like that? If you buy frozen blueberries, you can buy organic, wild, frozen blueberries maybe for a third of the price than you would buy regular ones from Peru, or they already, coming from still, the local harvests are done. Yeah, so they are coming from South America. So yes, in ideal world, but it's much better that you eat fresh. If you go to local farmers markets, many of them are not organic, but they use minimal amounts of, it's very hard to be certified organic. Yeah. It's a long story, but yes, when you can, if you can, I think that's secondary. The primary is make sure you eat a lot of, when you eat vegetables, fruits as a dessert, 100% whole grains, any kind of beans, lentils, peas, chickpeas, hummus, tofu, tempeh, and nuts and seeds, and then you add whatever you desire from animal foods, small quantities. Okay, I think we're out of time, no?
Yes, unfortunately.
Thank you all.
Thank
I hope
you.
you'll experiment with some of those things, and I'll be around if you have more questions. Okay.
Thank you.
Thank you.